This is Plant-Based Briefing, Wholism, Rethinking the Science of Nutrition, from the Colin Campbell Center for Nutrition Studies at nutritionstudies.org. And I'm Marian Erickson. This is the curated content plant-based podcast, where I narrate articles on plant-based and vegan topics with permission in about 10 minutes or less every weekday. So now let's get to today's Plant-Based Briefing. Wholism, Rethinking the Science of Nutrition, from nutritionstudies.org. What is holism? Wholism is a lens through which we might view the world differently, a critical concept that emphasizes the interconnectedness of the parts of every whole. It can be applied to our understanding of many different fields: biology, psychology, ecology, and more. Though holism does not reject the study of parts, it does incorporate what we learn about parts into a greater context. A holist believes, as Aristotle expressed over 2 millennia ago, that the whole is greater than the sum of its parts. The health of an individual body is a great example of a whole that exceeds the sum of its parts. The complex integrated systems within our bodies that support health, all the way down to the cellular level, have been fine-tuned throughout our long evolution as a species, and none of these systems is completely independent of the others. They all work together, rely on each other, and are constantly readjusting to suit the greater cause of maintaining whole balance. To understand health in this way, through the lens of holism, is to understand the limits of our need to distinguish between parts. Paradigms: holism versus reductionism. A paradigm is a model, often unseen, that 1. Determines how we approach the world, 2. Informs how we receive and understand new information, and 3. Shapes how we integrate new discoveries alongside the information we already have. Understanding how paradigms work is critical to understanding how we understand. Whether we're conscious of them or not, they determine the course we take. In fact, you might say that they are the course we take. Holism is only one paradigm. Another more dominant paradigm is reductionism, which is characterized by many things that seem opposite to holism. For example, a reductionist is accustomed to thinking of the body as a collection of individual parts and systems, in which solitary chemicals do solitary unrelated things. As the name implies, reductionism is focused on reducing wholes to their parts, breaking things down to better understand the individual components. These paradigms are not necessarily incompatible. Holism does not reject reductionism, either in theory or in practice. Instead, holism encompasses reductionism. Problems only arise when one paradigm dominates so completely over the other that we're no longer even aware of the control it exerts over our thinking. And that's exactly what has happened in nutrition and medicine more broadly. Examples of reductionism in these fields include: 1. The research that is considered best is most often that which focuses on individual nutrients rather than broad dietary patterns. 2. An outsized focus on individual chemicals or genes as contributors to disease rather than multifaceted lifestyle factors. And 3. Highly targeted technological approaches to disease treatment, perhaps best illustrated by the pharmaceutical industry, that produce huge costs and unpredictable side effects and yet consistently fail to address the basis of disease. Holism in nutrition. Reductionism in nutrition can serve a valuable role. Discovering the inner workings of individual macro and micronutrients can help us to fill in the gaps of our understanding. However, nutrition cannot be understood by only the study of its component parts in isolation, because nutrition, as it operates in the body, is far more complex than these individual reactions studied in isolation. By shifting toward holism, we would continue to improve our understanding of the parts, but also begin to examine the complex, interconnected impact of multiple nutrients working on multiple health outcomes. This is how nutrition works in the real world. We do not consume single nutrients in isolation, but do consume whole foods comprised of numerous nutrients in a varied diet. One example of reductionism's dominance in nutrition is the booming nutrient supplement industry, projected to reach a market size of $216.3 billion by 2026. This industry is predicated on reductionism at every step of the way, from how supplements are developed to how their benefits are researched and reported on. Holism in disease treatment. Reductionist medicine tends to view diseases as distinct, with highly specific causes and highly specific treatments, applied by highly specific specialists. In other words, the approaches to diagnosis, prevention, and treatment are all very compartmentalized. In cancer, for example, one researcher is devoted to testing carcinogenic toxins, Another, quite separately, investigates the genetic roots of the disease's progression. A third, perhaps working in the pharmaceutical industry, argues that if we could only identify the highly specific mechanisms of the disease, we might then be able to develop drugs that interfere with those mechanisms. Though we might learn something from this approach, when it dominates completely, it can become very restrictive, especially when the disease's cause and treatment are more complex, as in diseases related to a lifetime of poor nutrition. Reductionist medicine encourages us to view disease response and disease prevention as distinct. We prevent heart disease with exercise, stress management, and a heart-healthy diet, but once the disease has developed, the notion that we might reverse it by the same measures is not given as much attention as surgical and pharmaceutical approaches, like bypass surgery. For many, the prescription of dietary change to a heart disease patient might even seem irresponsible. The human body is divvied up between different medical specialists, each with their own reductionist approach. And though this approach is very effective for dealing with certain situations like bone fractures, certain infections, etc., it does not cohere as well with the integrative effects of nutrition. In a medicine that is dominated by the reductionist paradigm, holistic nutrition will never play a large role. This is one reason why medical doctors are not trained in nutrition and why there is no designated Institute of Nutrition at the National Institute of Health. Whole health. One of the side effects of viewing health as a sum of parts, as in a reductionist framework, is that we can focus on one element of health without giving due attention to other related elements of health. In other words, we can obsess over the impact of certain actions on certain aspects of health, but without attention to breadth. It is by this reductionist logic that a health nut might focus heavily on a weight loss regime without improving the other components of their personal health. Likewise, it is how we might focus on personal health alone without paying mind to connections to communal health and ecological health. A reductionist framework is very susceptible to misalignment, and this misalignment is reflected at every level of our health-seeking enterprise. There are countless examples, including we seek public policy solutions to health problems without giving individuals, even doctors, adequate education in nutrition. We try to plug our holes with a medley of drugs and supplements while consistently poisoning our holes. We tell individuals to be more responsible, but we fail to curb industry's profit-driven influence over what is available, affordable, and recommended by national dietary guidelines. We tell our children to eat more fruits and vegetables, but permit the influence of industry in designing national food programs, including the school lunch program. And we make the job of producing food in an ecological and sustainable way very difficult and costly, and in fact, incentivize farmers to do the opposite. The food system is rife with such imbalances. By adopting a more holistic perspective, we might begin to appreciate the interconnectedness between the challenges we face. Learn more about how we're putting holism into practice to create resilient, regenerative systems of health through food, linked here. You just listened to Wholism, Rethinking the Science of Nutrition from the T. Colin Campbell Center for Nutrition Studies at nutritionstudies.org. And I'm your host, Marian Erickson. One of the references listed in this article is Whole, Rethinking the Science of Nutrition. It's a best-selling book by Dr. T. Colin Campbell. And it says, in Whole, T. Colin Campbell, PhD, explains the science behind the evidence that a whole food plant-based diet is the healthiest way to eat. He explores the ways our current scientific paradigm ignores the fascinating complexity of the human body, and why, despite overwhelming evidence that everything we think we know about nutrition is wrong, our eating habits haven't changed. Whole is an eye-opening, paradigm-changing journey through cutting-edge thinking on nutrition, a scientific tour de force with powerful implications for our health and for our world. And the more we learn about holism, and especially in comparison to our reductionist views, the more we realize we have no clue how much we don't know yet. And I'll link a couple of related episodes in the show notes. You might want to check out 566, How Accurate Are Measures of Nutrient Density by T. Colin Campbell at nutritionstudies.org, and 491, Reductionism, Topic Summary, and Reductionism and the Deficiency Mentality by Dr. Michael Greger at nutritionfacts.org. So please share this episode with anyone who might benefit, and thanks for listening.